All right, thank you so much, Eric. Our chairman, council members, fellows and colleagues in the HR profession, good morning. We want to extend a warm welcome to you to our second HR webinar series with the theme Coronavirus in the Workplace. What is the strategic role of HR? My name is Rose Sang. I'll be coordinating the webinar alongside our technology partner, Eric Mutuku, who runs Zalego Academy. So we find ourselves in very unfamiliar territory. The number of cases of the coronavirus has now risen to 31, at least as at yesterday. And the entire population is affected and is urgently called upon to act responsibly. We've heard about staying at home, washing your hands, social distancing to limit the number of cases of spread of this virus. Our healthcare system could be overwhelmed and we need to act together. As HR, we have a role to play. We must keep employees healthy, maintain their morale, and oversee remote working, and in some cases, lay off people, as we have seen in institutions. Our in-trays are bulging. However, business must go on, and people are at the heart of it. The question is HR at the center of business continuity planning? So today we are honored to have Engineer Patrick Obath, who is currently the chairman of Standard Chartered Group Bank. And he'll be speaking to us from his point of view, both having been a CEO, but also sitting on the board. What is the expectation of HR to manage this crisis? So Engineer Obath, karibu sana to our webinar. It's a pleasure to have you. But before we start, allow me to welcome our chairman, Joseph Onyango. I don't know whether you've logged in.
Thank you very much, Rose, and most welcome all the members.
Good morning, we can hear you. Please go ahead and give us your thoughts, Chairman, before we start.
Probably I should give my thoughts at the end like yesterday, and we allow engineer to start, and we just get into the theme of the matter. And thank you very much. I wish to contribute alongside the members.
Thank you so much, Chairman. For members, please feel free to go to chat and ask your questions. Engineer Obath will have 20 minutes to give us his thoughts, and then thereafter he will take our questions. So bring them on, we'll be recording them, and we'll ask him as we go along. So Engineer Obath, I guess the platform is now yours.
Thank you very much, Rose and Robert. Thank you very much for inviting me to participate in this activity. When I was first invited by Rose, I was wondering what does an engineer who has spent their life in the oil industry and away from everything have to offer to HR practitioners in terms of the area of specialization. But talking about business continuity planning, but more important, business continuity management, I think is a key area that all of us share. And understanding the roles of each of the people who are involved in a business continuity scenario, I think is very important. But I think the key thing is that COVID has brought around something that is not usual in terms of business continuity planning and business continuity management. This is something that is not around the nuts and bolts of the business itself. It's around the human capital that runs the business. And then what you've done is basically, instead of having them in an area, you can sort of work with them together. The COVID pandemic has basically forced us to basically put them apart. So it then sort of stretches the traditional scenario that you have of business planning. But just as a start, I think the role of HR in business continuity planning, I think, is getting more and more key in this day and age, where the expectations of employees change rapidly. We are also in an age where we are connected digitally, and so news, perceptions, and the way people work changes very, very rapidly as a result of the digital age that you're in. So the traditional role that has been taken in terms of BCP, I think, becomes a lot more difficult in this particular era. So going to a traditional BCP, what happens is that the BCP is mostly planning around the business, and you call it business continuity planning. And I would have preferred to call it enterprise continuity planning, because enterprise includes everything, not just the business processes themselves. And HR has a big role in terms of being in the center of the business planning process, especially in this digital age that you're in. So we have to look at not just the business itself, but the people who run the business. And in this area, I think HR has to become a very, very strong leader in terms of participating and designing the business continuity plan for every organization. Now, the reality at the moment is that most business continuity plans are built on trying to recreate the same way of working or business environment, but working remotely or in a different location. So what you're trying to do is basically, if you talk about a typical office block where people are working, you try and say, fine, this person does this normally in the office block, can they do it somewhere else? And then you create the condition for them to do that remotely. And as far as most business continuity, people think that they've done it because now the business can continue, people can access the central servers, they have information, they can chat online, and they can do all sorts of things. That basically means that all they're doing is running the business, but remotely. But the key thing is that when you start talking about business continuity planning in this era, it is not just doing the business itself, it's the condition under which people work when they're in a remote location. And with COVID, it makes it a lot more difficult because even that remote location is under threat. Most business continuity plans assume that once you remove people from the office and put them in a remote place, then they're safe where they are, and then work can continue. And then all you do is basically monitor the work and things can continue. But COVID basically means that the threat does not go away. It is still present in that remote location. And therefore, the business continuity has got to take into account the fact that even in that location, people are vulnerable and can undergo and are threatened in that particular area. So what it's done is forcing a lot of companies to move much quicker and much further down the remote working route and understand what remote working is and how remote working needs to be managed in terms of not just a business process, but the fact that you now have an employee who is not in a central location, but is in a remote location that exposes them to a lot more threats that are different from the ones that you would normally have in a controlled location. The other thing that working in this kind of way brings around is the fact that the managers and the leadership are used to having, you're able to walk down the road and see how people are working and understand the pulse of the business, how things are working and so forth and so on. And yet now you are expecting that people will be doing what you normally are able to supervise, so to speak. So there is a challenge also when you look at this around managing people and managing emotions, managing perceptions, and so forth. So sometimes getting into a remote working or a distributed working model means that a lot of the managers will actually become very uncomfortable and be very stressed as a result of the fact that you've changed their comfort zone has been disrupted. So what does that mean in terms of, this is just setting the scene in terms of the kind of things that happen when you go to work remotely, in terms of the structure of the organization, the threats that people have when they're working remotely, and the threats that the management itself has in terms of managing people remotely, because people normally don't think of managing remotely as a complete skill in itself, rather than just having people work remotely. So one of the key things that HR can contribute to in a business continuity planning process is basically how do you design the way people are organized remotely? How do you put them? Are they going to be in sort of distributed teams? Are they going to have the right kind of technology and support to that technology remotely where they are? Is it going to come from a central place? or are they going to be into teams with individual team support to make them work effectively? So that's got to be designed early so that when you have a business continuity situation in the traditional sense, that is not without COVID at the moment, in the traditional sense, that people are able to function remotely in a way that does not create problems for the individuals. Now, how do you understand the stress that people might undergo if they're now trying to run an organization from a remote location rather than from the comfort of the office where they can see everybody? And especially in this day and age where most offices are kind of an open plan and you have eye-to-eye contact with a lot of people. So you've got to consider the sort of the social and psychological impact that this might have on the people when you design how you're going to implement your business continuity role. The other thing that happens when you've got a business continuity plan is the fact that the priorities will and may, and in most instances will change, especially from the point of view of are you going to change your business targets for the short period of time or for the medium period or even long period of time that you're going to be working remotely? Are the immediate deliverables going to change so that people can focus on what they can do better when they're remote than when they're together? So these are some of the things that you've got to look at and get managers to start looking at in terms of the teams that they manage, in terms as to how they're going to rejig the performance expectations at a given time. It doesn't pay to sort of have bad performance at the end of a period and say, oh, it was because of COVID or because of a particular issue that we had. It should be something that you anticipate and say, we may need to change our plans and our targets so people can still perform given the extraordinary circumstances that they have and be able to perform at a high level, rather than using the emergency that you have as a reason for bad performance. So let us, as HR managers, you've got to try and get the business managers to start thinking differently every time you have a situation like this, and include in the business continuity plan how you're going to be able to assess that quickly and then be able to get the teams to discuss and agree how they're going to work in that area. So the distributed working in terms of the priorities is not just a relocate and continue. It's got to be a relocate and basically redesign and deliver in terms of the business processes. The other thing that we have to be very clear about is the fact that we have to deal with people's emotions and worries. And as HR practitioners, these are real things that you may not touch and feel because you cannot see the people. But they're there at the end of a telephone, they're there at the end of some technology, and those people have real feelings, have real worries. And also the fact that when you're sitting in the house or in a remote location working, the stresses that are being generated there are completely different from the stresses that are being generated where you are sitting in the office. I'll give an example of myself. I mean, I am now retired. I do most of my work in different places. So I attend board meetings. I do a bit of consultancies. I don't have an office. So I move around to do things as and when. So you can imagine that right now, I'm normally away from home the whole day. So right now I'm back at home and I'm spending the whole day at home on technology, chairing board meetings, chairing whatever it is, and basically doing a bit of consulting work. Now, all of a sudden, people at home are seeing me in a different light and beginning to wonder, so my friend, you're under stress, you're doing a lot of stuff, you're doing this and the other. So that kind of reaction when you're at home will actually mean that you have a lot of stress. You may have a lot of stress, you may have a lot of disturbance, and therefore it means that the way you're going to work has got to be understood. Mm-hmm. So for those who've got families, who've got children, who've got people like that, how does that affect them when they're working remotely? Do we need to understand that? What setup is possible in the remote area? Because everybody assumes that when you go to work remotely, especially when you got a business continuity activity, you just take your laptop or your computer, go home and work from there, and things are done, people are able to work. I think we need to be a little bit more invasive to understand really how does it look for the employee? How is it, what support do they need in order to create a conducive working environment in the house? So it actually is not as simple as saying, fine, people are now working remotely. To have a successful implementation and management of a business continuity plan, you need to have all these issues fully understood and managed, either at a corporate level, where you actually design the system, and also that the teams, as they are, also understand fully that they need to manage, to understand people's individual working circumstances and be able to incorporate that into how they work and the way you expect them to deliver. So it's actually quite a complex look when you're talking about business continuity planning. And when you look at all this, it is important that as HR practitioners, you lay all this out on the table, that these are the things that have to be considered in detail when you're putting together a business continuity plan and the business continuity management process once a plan has been implemented. And then all the managers in the company, or the leadership team, have to understand all the issues that are going to be the ones that they have to deal with when this thing is happening. And then after that, put in a way of being able to support the different managers who are running the teams and the employees, so that we are actually getting them to deliver at the best that they can with the modified priorities in the locations where they are. And this is not an easy thing to do, and it all depends on the DNA of the organization, how people relate to each other in the first place from the start. So if you've got an organization which has got a very fragmented relationship within the organization itself, then trying to do a BCP and running it effectively remotely becomes a very stressful thing, especially for HR managers, because tempers get frayed, and tempers, when they get frayed on a distributed working model or a remote working model, people can walk out of the room purely by shutting off. And then you can't get them, you can't talk to their office and sort of try and talk to them. They're basically disconnected from you completely. So one of the key things of having a successful business continuity plan is to actually have a very well-coordinated and very cohesive organization, that when there's a disruption in terms of the way they work, that cohesion becomes a strength that keeps them together, even when they're sort of they're fragmented and feeling a bit stressed when they're working remotely. So how does that happen? I think one of the key things that a lot of companies are getting into this day is the issue of wellness in companies. Wellness is a very good cultural changer, where you basically, it brings people closer together, because wellness looks at the whole of the person or of the employee. And when you start doing that, they start being comfortable with each other, talking to each other, and basically relating to each other better. Some of the things that happen in wellness campaigns in our companies, people start going to the gym, they start walking, they start eating healthy, they start talking to each other, they begin to understand each other. And that actually makes it much easier for them to work in a business continuity, where you've got people working remotely under business continuity process, rather than if they didn't have all that. One of the other things that also needs to come through very clearly is that at this time, with the COVID-19 situation, the ability to respond to the stresses that the employees are having, how do I know I have COVID-19? The government support, has that been tested? Does it work? We have a bit of interference. Okay. I think somebody has to mute their microphone. Okay. So for each of the employees, they've all been told by the government what to do. If you've got, if you suspect you've got the corona, please call a certain number, and we will come to you. A lot of people have tried that, and it doesn't work. Now, somebody has a microphone on, and you're getting feedback through that microphone. So I'd appreciate it. Okay, thank you. So if people have tested and it doesn't work, is it something that you as HR practitioners need to put into place so that there is always an alternative for people to be able to get that kind of support. One of the other things that is also useful at this kind of time is basically to have a company doctor. And I think most people have company doctors as people who treat their employees. But in my day and age, I had a company doctor who was not a company doctor who treated or managed whatever. That company doctor was my personal advisor in terms of the health of the organization. So he was contracted not to treat, but to help me manage. So he was a good data analyst, somebody who can look at the information that is coming from all the service providers that we have. He coordinated them, selected them, and also ensured that the data that was required in order to manage the health of employees came back in a sanitized manner. And we were then able to plan our interventions with the population much better. When you've got that kind of system whereby you actually get information very quickly when things begin to happen, it means that when you've got a situation like this, where people are at home and they're probably going to be at home for the next 2-3 weeks, situations of health other than through COVID can begin to develop because of the stresses that are happening. And people might go and see their doctors. That kind of information can come through very quickly, and you begin to understand some of the changing dynamics in terms of remote working across the whole population that you have as an organization. And that then allows you to begin to do some interventions even before the problems become bigger. As I said earlier on, people working at home may become a lot more stressed as a result of working at home, which they're not used to. That stress will not come through, you will not know about it, but if that guy gets stressed and he goes to see a doctor at that point in time, you will begin to realize that there are a few people who are beginning to show signs of stress. And then you can, through the doctor, begin to put in some kind of remedial action that needs to be taken in order to make that person work under less stressful conditions. It may be that there is a center they can go to that you sort of say, fine, if people want to, and you don't say for a particular person, you can say if people want to, we have actually now allocated, there are some centers you can go to where the social distancing will be okay, and you can work there for a couple of hours each day or 2 or 3 hours and then go back home. So these are the kind of things that when you've got a central situation that somebody is able to gather data from your service providers, your doctors, your hospitals, your clinics, your pharmacies that are getting medicine, all that is absolute data. So in this day and age of big data, the company doctor needs to become somebody who is not just, does not treat, but is basically a data manager to be able to ensure that you have the right kind of information and analysis for you to design the right interventions for the staff. And when people are working remotely like now, it is even more important that that kind of invisible data that you currently don't see is available and can be analyzed by somebody who is an expert in that area. As I come to the end, a couple of other questions. When you have a health insurance scheme, how do those health insurances operate with respect to pandemics? And the fact that these kind of pandemics or even epidemics can actually aggravate existing conditions to make them a lot more threatening, life-threatening, or causing disabilities and so forth. So have you looked at your medical insurance and made sure that they're covered at this time? It is something worthwhile to look at in your business continuity planning. When you look at scenarios, look also at the cover that you have and see whether some conditions that are generated by actually working remotely are still covered under that, or are these things that can be excluded as a result of them being caused by an external factor. The other thing that needs to be looked at is if people are removed very quickly, and for COVID that will happen, do you have a clear leadership cascade within the organization? If somebody is taken out and very quickly put into isolation, is there somebody who can step in immediately with all the auto authorities that are delegated to them and they can work? What about if an employee is taken out, and how is the family supported? That is another consideration, and I'm sure most of that has been taken care of, it's obvious. But think of the other situation. If the employee themselves is still okay, but the family is actually now under stress, how do you manage that? Because now they will be out of, they are able to work, but they can't because they're having to support the family. And also, given that we are slowly moving towards a sort of a lockdown in the country, we are taking step by step. It may not reach there, but if it does, are we ready for the lockdown situation as a company? Is that planned for? Do we have a situation whereby effectively people will be locked down, they stay at home and they can't go anywhere, they can only go to the pharmacy, go to the supermarket and then go back home, and they can probably go out and run on the street for only a few hours in a day, like they've done in the UK. How are we going to manage that? Do our business continuity plans look at the kind of situations, the family situations that are likely to arise out of that, and how can you support them proactively in those kind of situations? And in terms of the corporate side, how do you look at the people who then suffer from this COVID? Is it covered under your annual leave, sick leave, and so forth and so on? All that, in fact, that discussion, employees should have the comfort of knowing exactly how the company thinks, even as of now, as the situation is developing. They should actually know, rather than have it as something that is close to the chest, that you will only release when people sort of come and ask the question. Proactive information is a lot, gives people a lot more ease of mind than waiting for things to happen and then you tell them, yeah, by the way, this is what the policy says. They should understand that much, much earlier. So, in closing, I think we must remember that part of the most vulnerable population that we have are the population that have underlying conditions. As HR people, you are the people who know what those underlying conditions are. And when you understand what they are, you are able to match, you're able to provide leadership in terms of the kind of roles that those people should be allowed to take or not take because of those conditions that you have. This is without disclosing why you're doing that, because obviously protection of information is very important for those people. And so you should be able to direct the leadership of the company about the best way of allocating the resources, both human resources and other resources that are required, so that there is the best use of those resources during a business continuity event. And the last thing I'd like to talk about is just to say that even as we are now managing this crisis of people working remotely with COVID, are we thinking about the post-COVID recovery period? How are we going to re-engage? And then we need to make the plans for that, both not only as HR practitioners, but within the role of HR in the bigger continuity process. How are we going to recover? What kind of condition will be people in when they come back? And as the COVID emergency uncovers over the next few weeks, we should be basically reviewing those recovery plans and saying, okay, fine, we've reached this point, these are the potential impacts, this is how we will recover given that these are the impacts of now. And we should continuously be looking at the impacts of the emergency we have now and look at the recovery that is required as a result of those impacts. So I will end at that point, Chair Rose, and then I'll be open to questions and comments. Thank you very much for listening to me.
Thank you very much, Engineer Obath. I'm sure members are clapping as we have listened to you. So just a couple of questions that have come through. Where do we start now? I mean, we are already in this. There are organizations that haven't really thought through enterprise continuity planning. What's a good place to start?
I think if the enterprise hasn't thought through, I think the best place as an HR practitioner is to say, listen, I am concerned around the impact of this on the people that we have. So we need to have a plan for the people. We need to have a plan for our staff and so forth to make sure that they're safe at this time. That kind of sentiment will basically touch at the hearts of all the leadership because they are part of it. They have that concern as well. And then as a result of that, you can then push for saying, fine, now that you've looked after the people, why can't you look after the rest of it and look at the impact of people on the business? So I think the emotive part of looking after people is normally a very, very easy way of getting people to start talking about business continuity planning. And if you don't have the expertise in-house, there are people who can help. You can talk to your colleagues who have done that. And if you're in a small organization that doesn't have that kind of thing, you don't need to reinvent the wheel. Just talk to somebody who's got a plan, and I'm sure they can sanitize it, and then they can say, fine, this is a typical plan. That's the way I did my initial business continuity planning, was basically to talk to a few friends and say, you guys have got it. Can you give me a sanitized example? And once it is sanitized, you can use it and create your own. Thank you.
Okay. So I know that you sit in a couple of boards. One of the questions here is, what are some of the practical things that the organizations that you're involved in are doing?
There are a large number of practical things that you can talk about, because when you implement a business plan, you actually do things. You're doing a lot of things. And most of the organizations are doing things at the moment. The first one and the first thing was basically to, and this is just the application of the normal business plan, was to, in the very first instance, before we even got to the lockdown situation, a lot of the organizations sent people home. So we're working at 50% capacity already. And at that time, what we did was we tested the systems just to be sure that they could work. And we had 50% working and 50% at home. And then we then brought back the 50% who were working from home, and then took the other 50% out again. And then that meant that effectively with those two, you had tested everybody over a period of about 1 week. This was about a couple of weeks back when the pandemic was starting. So we had done all that and tested all the facilities of people. The biggest challenge that we then found in a lot of these instances, and I think this you need to be able to test more regularly, is when all of a sudden people are working from home, and your bandwidth, your internet bandwidth and the IT bandwidth coming in has now got not only your customers, but it's also got your staff and everybody else coming into the center through the internet. You found that the bandwidth you're carrying basically is not sufficient. So that happened much earlier. So you actually increase the bandwidth that is available so that people can work remotely. So I think just basically testing components before you need to do them and assuming they're going to happen in time is very important, that you do that. And you sort of do it in small pieces and then do the whole lot in one go. Otherwise, you may find that you go into the BCP and then you're stuck. Thank you.
Okay, thank you for that. There's another question here around the presidential directive for those above 50 to work from home or take leave. Knowing government, a lot of these people have had a lot of experience and there have been challenges around succession management. So what would be your advice to those who are in government around this presidential directive?
I think, again, this is, the directive looks quite onerous, but if the government has got their business continuity plans, it doesn't really matter, because those people can work from home remotely and they can still deliver. But I think what they've realized is that these people are, when they're working as government, they're basically at the front line of dealing with people. So they're very much exposed at that kind of level. So the older people, as has been sort of shown from the different, from the statistics that we're seeing globally, the older people are the more likely to sort of be badly affected by the COVID virus because of the sort of slightly less robust performance of their immune systems. So I think it's the right spirit, but I think just making a sort of a top level announcement like that without understanding the implementation process, I think that we need to be a little bit more careful when you still sort of give a directive like that and expect it to happen immediately. I think for most of us, as I said earlier on, we need to understand that we need to have the systems in place and test them and then get people to go. So a directive is great, but a directive is only great when effectively we have the systems in place. And I think this is an unusual thing for the government, because the government really has been very, very shy in going to a complete e-government, as it were. And this has been a push from, I think, about 2007, 2008, and we're now almost 12, 13 years down the line. when we started pushing for the government to go completely as e-government and have digital systems everywhere, it would have meant that changing back to a place where people are working from home in the government would have been much, much easier. But at the moment, I don't think they'll be able to achieve that as quickly as the private sector can. Thank you.
Okay, so there's another question here around performance management. And, just share experience around how this is being managed in the various organizations that you're involved in, especially with regards to targets. We've seen a lot of, manufacturing companies and even those, in the tourism industry sort of shutting down or scaling down operations. So you had targets before. How is that managed? What has been your experience in that space?
When you have sudden external factors that sort of impact on the business drastically, I think the first thing you've got to do is, as a leadership team on an organization from the board, you've got to work with the management and say, fine, what are the impacts of this particular external force on our business? And then again, if you hadn't seen that as a risk, because normally if you've seen this as a risk, you'll have a risk mitigation plan. But if it is something like this, which you never, I don't think any company had a COVID risk as one of their issues, but and we probably had other health risks, but not one of this nature. You then need to sit and digest the risk to you internally as an organization, and then onto the business environment in which you operate. And then you basically got to say, fine, are we going to modify our plans? Are we going to go somewhere different? And recognize and change your forecast for the short-term period and say that this is a realistic new way we are going to have, and then cascade that down to the individual managers, and at the appropriate time, just do the correction in terms of the performance expectations or the return expectations on your staff and employees. And then maybe, and after the thing is over, you then do another review and recalibrate again. And then once you've got a more steady state situation, you then say, fine, now we can look and see what the end year game is going to be compared to when before the external challenges started. So I would suggest that, for example, if you had the first quarter, which is just about coming to an end, that is taken as done. And then for the next quarter now, you say, given if the COVID the COVID emergency is going to continue, say, for another 3, 4, 5 months, what does our business look like? How are you going to be affected? Manufacturers, the tourism trade, you're talking about air travel. The airlines basically are grounded because everybody's stopping people from coming in and out, and so forth and so on. All those have got to be put in. And if your business is affected by the lockdown of any of the other businesses, you have to factor that in and change your business trajectory expectations. And then on the basis of that, then look at what people can do to deliver on the revised expectations. So it's going to be a reiterative process. And I think this is where now boards have to be sitting down, and the boards don't go on holiday when this kind of things happen. Boards should really be sitting down maybe every 2 or 3 weeks just to sort of understand how the business is changing and how this is going to affect the overall business, so that by the time there's better clarity and there's more stability in terms of the COVID, we can then begin to look at our plans, give management sort of proper guidelines, and then they can then modify the performance expectations of the staff in the company. Thank you.
All right, so I think we are sort of running out of questions, but I think 2 more that we have here. One is around, in the event of a lockdown, what are some of your thoughts around scenarios that may possibly play out, and how should we then react as a HR fraternity?
That is a question that is difficult to answer, because there are lockdowns and there are lockdowns. And I think in Kenya, we're in a partial, we've got a curfew at night, but we don't have a lockdown as such. We just got a slowdown. You go to somewhere like South Africa, basically, where there's a lockdown, in the UK, where there's a lockdown. I think let's take the extreme, where you have a complete lockdown and basically everybody stays at home and you go nowhere. That means you cannot manufacture, you cannot do any normal work, and so forth and so on. So it means that what you call the normal productive industries have to shut down. The only people who will be left maybe operating when you have that kind of lockdown are people who are supplying food and the food supply chain, people who are in the pharmaceutical are supplying medicines, the healthcare people and the suppliers to the healthcare, and then the emergency services, police, hospitals, ambulances, and so forth. And that is literally all that will be available. So even your guy is going to open shops, that will be shut down completely. When that happens, for the traditional organizations where we are at the top level, it means that you're now going to have a lot of staff who are probably doing nothing. So they're just going to be at home twiddling their thumbs, unless they're involved in those key industries that need to support us when we are in the lockdown phase. So the issue of the management of individuals, the emotions, the social and psychological status and everything else will become a lot more important under those circumstances. So we need to start thinking about, even at that point in time, how can we keep our employees working? What kind of things can they do at home? Do they go and buy board games? Do they buy more books? Do they have online sort of chats and tweets and play games and so forth? There's a lot of consideration that has to go in when you've got a complete lockdown. And even the traditional places where people could go, like clubs and health gyms and all that, all those will be shut down. So the unit at home will be something that as HR people, you have to start thinking, if people are locked down and they can't leave their houses, what pressures are going to be there? What kind of employee do we want leaving that house coming back when the lockdown is over? And how can we make sure that when they come out of that place and come back into the real world or the post-COVID world, that they can still help us begin to recover from the lockdown where they will be in. So what I've done is basically asked a lot of questions rather than given solutions. But I think even at this point, we don't have solutions. All we can do is to continuously ask the question that if somebody is in a closed down room with his family for a period of 3 to 4 weeks, what support do they need? And how do we then help them recover from that when they're coming back to work? Thank you, Rose.
All right, thank you, Engineer. The president gave a speech the other day, and he spoke to tax breaks, tax reductions, payee, turnover sales. Just very briefly, break that down for us around what it means for our businesses. And do you think that they will be effective, given that 70% of our population is in the informal sector? So when you give payee cuts, does that really, is that significant for us within the Kenyan economy? So just a quick overview around, the presidential speech that he gave the other day.
Yeah, I think what we have to be cognizant of is when you do interventions, how do you make those interventions work on a national scale? And in Kenya, where you've got a lot of informal sectors, how do you define them? Who are they? What needs do they have? And so forth and so on. I mean, that's a question that even if I asked any of you, everybody will come up with a different answer. And let me just step away from Kenya and go to the more, to the sort of the more developed economies. One of the reasons why having a tax number and declaring an income, even if you're not taxed, it means that when you are in that system, people understand the economic impact or the economy of who you are and where you work. So even in informal sectors elsewhere, people still have a number under which they can receive money, or they pay tax, or they at least declare their income, even if they're not taxed. That is a very good database, so that when you begin to plan a national response to an emergency, you are able to do it from top to bottom. Now, in an informal economy, where in a country like ours, where the informal sector is actually is bigger than the formal sector in terms of numbers of people, rather than the contribution to the exchequer, you have a very complex situation that you're going to try and answer. If you are going to do an intervention that is going to look at the people in the informal settlements, how do you structure it? How are you going to cost it? How are you going to provide the money that is going to basically support that. We don't have that in this country. So I think the first thing that is got to be done is basically to give the break so that the productive part of the economy is able to function and at least continue working to pay tax. So when we come out of this, those incentives are there to basically create get the productive part of the economy to begin to work and pay tax so that the government can meet its obligations. And I hate to say this one because it's probably one of the beefs that I have with government is that they'll help them pay their staff, but also meet the obligations they have to the population, especially the population that is marginalized in this country. So the government is caught between a rock and a hard place. The only place they can do sort of direct interventions and announce measures is basically on the productive economy. But when you go to the informal sectors and the settlements that we have and so forth, to try and design an intervention during this time, I think is probably giving the government and also some of us who are involved in trying to help them think through quite a big headache in terms of how do you ensure an equitable intervention in the informal sector. And of all the sort of 200 odd people who are participating in this webinar, if there are some good ideas, we'd like to hear them so that we can actually begin to test them through the discussions that are happening now. On a personal basis, I don't have an answer to this. We are still developing some scenarios. But the stuff that the president did was basically in terms of trying to get the productive part of the economy up to speed as quickly as possible so that they can begin to put money into the exchequer. And if you look at those interventions, most of them end up with the central bank putting some money in somewhere. So that is where really the stimulus is coming from, is basically the money that is coming from the central bank into the different areas and then diverted or distributed into the productive economy, either to keep it going or to make sure it is ready to start up when the emergency is over. Rose, over to you. Rose, I'm done. Is there any more questions?
I think for now we are pretty much done with the questions. So just to recap, in terms of your thoughts around enterprise continuity planning, we've talked about distribution working and what that means for HR and planning for that, business process reviews as well as HR policies. We need to look at wellness programs in terms of managing stress, but also looking at the data that's coming out of our medical service providers to be able to make proactive decisions. Key to that as well would be a leadership cascade, ensuring that we have a product succession plan. Should we then get into a situation where the leadership is unable to perform, but also family support for our employees who are working remotely. So thank you very much for those thoughts. I hope you will not tire when we reach out to you again. The questions are coming in fast and furious. I know that you have other meetings as well to attend, so I want to say a big thank you to you for taking the time to enlighten us on enterprise continuity planning. So allow me to invite our chairman to give his thoughts and remarks before we can conclude on the webinar. Chairman, over to you.
All right, thank you very much, Rose, and thank you very much, Engineer Patrick Obath. I think this has been really helpful, and to all our HR practitioners out there. Yeah, I know it's not possible to answer really all questions, but these discussions are really quite insightful and helpful to all of us. Just a very quick recap on the next sessions and what we are expected to do is that I think the next webinar will be around the practical things that an HR practitioner, the things that we are faced with, can and is in a position to actually voice out. Number one that comes to mind is that before anything else, and I think this we talked in the last webinar, is that the first priority is about life itself. and that HR practitioners would be the first people to be really well informed. First is to safeguard life. Before we think about the businesses, before we think, it is about our life as a people. And I think it is much more overemphasized that now it is the best time actually to look at humans, not just as a resource, but as people, first of all, because that take precedence. Number two, that has come, and so many questions are around that, is about the legal implications and all that. We must appreciate that, number one, it is not about the laws now, because these are extraordinary circumstances. Look at what government itself has done. First of all, it takes care of the scenario before, and then you can go over and start gazetting issues. You realize it is as late as yesterday, government was actually gazetting issues after decisions have been made. And therefore, we should not be so much preoccupied about the legal implications. What about if I'm sued about this? Is first of all to look at what are these things, that the decisions that you can make that safeguards the lives, the people in the organization. Then the other things can actually follow. And that actually is what government has already done and has shown by example. The third is around the issues of, say, pay and what government is doing in terms of the tax brackets. And it applies, I think, more besides the practical, because we know how much of our people are in informal and formal areas, but also it applies to our emotions. And this is a time when HR, and in another forum for CEOs, I was saying, just like in crazy economic times, accountants and actuaries are consulted. This is the time HR people are consulted most, because it is about people and about their lives. And therefore, it is my belief that we will not wait. And as practitioners, and this I know may not go down very well with most of us, but our nature as HR practitioners, especially in this country and in Africa, is that we've been waiting over the period for instructions to come from leadership. This is the type to take up leadership and say, because this is our area of expertise, leadership, you must listen to us on this. And the emphasis will be around what are these unmeasurable things that computers and emotions, and I like what Susan has asked and is emphasizing on her charts about what about, I'm just going back to the charts on what Susan had asked, not about the core values, and was asking Rose, I'm expecting a response on my queries on core values and spirituality in the workplace. What are these things that we've been talking about and not implementing over a period of time? The things that machines cannot do, things to do with emotions, things to do with morals, and things to do with virtues of in our lifestyles. Much as can be talked about in terms of the BCPs, but I think the next webinar will be around the practical things and the practical advice. We can now see very well how much HR analytics come into play, the data that we have. What is the kind of response that are coming out of even our insurance agents and our insurance? What is it that we are getting very quickly, and what decisions can we make in the different scenarios? I insist again that we may be forced to run away from our long, what we call strategic plans, to now start working with scenarios, actual scenarios, and short-term strategies in terms of the 2, 3, 6 months, or the longest would have been maybe a 1-year plan. But now within the scenarios, what best can we advise leadership? I thank you very much, Rose. And I think till next time, which we should be very soon, we'll do yet another webinar. And around of it will be the practical things that HR can input. Thank you.
Thank you very much, Chair. Indeed, we do have our next webinar next Thursday, and the topic will be on the practical aspects of the workplace and the workforce and the impacts of COVID-19, which will be chaired by Dr. Julius Kipngetich, who is currently the Regional CEO of Jubilee Insurance. He will be speaking both from a CEO's perspective of some of the practical things they're doing within Jubilee, but also looking at the data that's coming out of insurance to then say, what are some of the things we should be looking out as HR professionals? So please tune in next Thursday at 10 to 11. We will send out the invitations later on today, and we look forward to seeing you. So also allow me to thank the team at the Secretariat, led by our Acting Executive Director, Ihrm Kimasha, as well as Fred And Danny, who works on the back scene to ensure that social media happens, that you get your emails, that the flyers go out. We don't always see you on the front, but we know that you've been very supportive to the process. Eric as well, who is at Zalego, is our technology partner who ensures that the system works, that your mics are muted. So thank you very much, Eric. To all the members, thank you for tuning in. It's been a pleasure having you. Engineer Obath, thank you for taking the time. We will see you on Thursday. In the meantime, keep safe and God bless. Kwaherini.
Thank you. Bye.
Bye.